Dr. Ball is a fairly standard fit lady. She's actually an exceedingly fit lady. She's a swimming coach and a PE teacher. And she's had problems creeping up on her for the last few years.
My knee was really painful before I had the operation. I could barely walk 200 metres before I was starting to hobble.
If you were God and you're designing a leg, you'd want to drop that plumb line from the middle of your hip to the middle of your ankle and going through the middle of your knee. So these are her x-rays before any surgery is done, and you can see that if you drop a plumb line down, that plumb line just goes through the inside of the knee joint. So when she stands up, her weight tends to go on the inside of the knee joint. This is the knee that's been causing all the problem, and you can see it does go more towards the inside on this knee than the other knee, and that it's a little bit whiter there. The early arthritis is there. So we planned an osteotomy to move that plumb line so that when she stands up, her weight is shifted to the outside of the knee, which I know from MRI scans of her knee and actually from looking at her knee previously with an arthroscopy, that the outside of her knee joint was pristine and no problems with it at all. So by moving the weight to the outside of the knee joint, we offload the bit that's causing the trouble and hopefully buy her some significant time. So she's had an osteotomy of the upper end of her shin bone, the tibia, and we've offloaded by moving the angle of the bone slightly so that when you drop the plumb line down her now, it's actually designed not to go through the middle of the knee, but very slightly to the outside so that we put the weight onto the undamaged area and offload the damaged area.
It was very sore, it took, I guess, about 2 months before I was really, the pain was right down below the level it had been before. So my operation was in December, but by July I was out hiking in the Alps, and quite the thing, and celebrating the fact that I had no pain and bouncing about.
This is her 7 months after the original operation without symptoms. She's walking around pain-free, back teaching swimming, back being a PE teacher. But her x-rays unfortunately showed that where we've opened the gap in here and opened the wedge, that it hadn't fully healed with bone. Now that is unusual, very unusual, but the plate and screws are so strong, she's got no symptoms from it. Now, unfortunately, 7 months down the line, if it hasn't filled with bone, it probably isn't going to, and it is only a question of time before the plate and screws may fail. And this is a CT scan of the same thing, and you can see more clearly now she's healed over on the far side, but the central bit hasn't fully healed. So unfortunately for her, we had to readmit her and do a bone grafting procedure, borrow some bone from her pelvis, from the top of her hip, to put into there.
And that was tremendously successful. I was up and about immediately, and yes, that's not a pain-free procedure, but it wasn't as painful as certainly it had been at any stage before, within 3 weeks I was very comfortable again, and now that's 2 months afterwards, I'm bouncing.